Now, another common condition that can cause problems to the foot is sesamoiditis or sesamoid injury. This is where the two little bones that live just under the bottom of your big toe, called sesamoids, get inflamed, most commonly because of overuse, but sometimes from trauma too. These two little bones are about the size of a pea and act a bit like a kneecap for your big toe joint to help it move when you're walking. There are people who are more likely to suffer this, and someone with a very high arched foot is most commonly associated, and those who have a genetic variation to their sesamoids. Now, it's reasonably common to see one of these pea-sized bones, or both, to be split and be in two pieces. So instead of having two bones there, which would be the normal anatomy, is that you have three or four. If these bones are split, and they're naturally split in two, they're more likely to suffer because two pieces isn't as strong as one piece. The most common reason for it is pressure build up on that part of the foot, and therefore the people we see most commonly with this in a sports medicine setting are footballers. If the stud falls right on those bones, it tends to irritate them. We see that also in players on hard ground or artificial turf. It tends to be problematic for them, and less so on proper grass in the times of the year where the grass will be wet. The treatment of a sesamoiditis revolves around trying to decrease pressure on those bones. So when you're running around, we might move the stud position. So when you're running, the stud doesn't press right on the bone, and that's quite successful. We can make inserts to go inside boots, take the pressure off, and we can do injections to take away some of the symptoms. We have to be careful by doing injections without taking away the provocative factors, because sesamoiditis can become a stress fracture, and the stress fracture can become an avascular necrosis, where the bone fractures, cuts off the blood supply to the bone, and then it fragments into lots of pieces, and then that's really it's a surgical case when it gets there. So we don't want to inject the steroid and not take away some of the causes of symptoms in those patients.